Analgesics. Mechanism of action. Questions regarding um, mechanism of action. Questions regarding analgesic, antipyretic in effects and effects on bleeding. Analgesic effects. Aspirin inhibits the synthesis of prostaglandins. Antipyretic effects. Aspirin inhibits prostaglandin synthesis in the hypothalamic temperature regulation center. Bleeding time. Aspirin inhibits the synthesis of thromboxane A2, preventing platelet synthesis. 2. A second type of question has to do with pharmacological or toxic effects of aspirin. You get to pick which of the list is or is not associated with aspirin. Therapeutic effect of aspirin include pain relief, antipyretic effect, antirheumatic, and anti-inflammatory effects. Adverse or toxic effects include all of the following: occult bleeding from the GI tract, tinnitus, tinnitus. Let's see how to pronounce tinnitus.
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 Tinnitus. Tinnitus.
Tinnitus. Okay, so that's the some of the effects of aspirin. Adverse or toxic effects, which include occult bleeding of the GI tract, tinnitus, nausea and vomiting, acid-base disturbance of metabolic acidosis, decreased tubular reabsorption of uric acid, and salicylism, delirium, and hyperventilation. A third type of question focuses on the difference between aspirin and acetaminophen, aspirin and other anti-inflammatories like prednisone, and between aspirin and ibuprofen. Number 1. Acetaminophen lacks anti-inflammatory activity, is hepatotoxic, and does not cause GI upset. Acetaminophen. Okay, again, a third type of question focuses on difference between aspirin and acetaminophen, aspirin and other anti-inflammatories like prednisone, and difference between aspirin and ibuprofen. Acetaminophen lacks an anti-inflammatory activity, is hepatotoxic, and does not cause GI upset. Okay, remember that acetaminophen is Tylenol. Remember, acetaminophen is not an NSAID. Anti-inflammatories like prednisone, hydrocortisone, triamcinolone, etc. are steroids and do not act primarily by prostaglandin inhibition. Ibuprofen causes much less GI irritation. Ibuprofen causes much less GI irritation. Diflunisal has a longer half-life than aspirin, acetaminophen, and ibuprofen. The diflunisal. Diflunisal is very used a lot for arthritis. Diflunisal is an NSAID. And um, okay, next, there's newer questions on the board of the board that have newer versions of the board have questions about COX-2 inhibitors like Vioxx. All questions that focus on aspirin. Um, Aspirin has many side effects that turn up in this kind of questions, but so since aspirin is a prototype drug to comparator prototype drug, reviewing these questions is still useful. Expect newer questions asking you to know that acetaminophen causes liver toxicity, especially when combined with alcohol or taken in excess of 4 grams a day. Acetaminophen is a drug of choice for the feverish child. The issue will ask the reverse, which is which drug should be avoided in the feverish child. The answer would be aspirin because of an increased risk of Reyes syndrome. Now, frequently asked questions on NSAIDs. Frequently asked questions on NSAIDs. Here it goes. The therapeutic effect of salicylates is explained on the basis of the ability of the drug to answer is to inhibit the synthesis of prostaglandins. Okay, so the therapeutic effect of the salicylates is explained on the basis of the ability of the drug to, and there are different options, but the right answer is inhibit the synthesis of prostaglandins. So you just have to know that salicylates are aspirin, and aspirin works by inhibiting the synthesis of prostaglandins. Next question is the mechanism of the antipyretic action of salicylates probably results from it's the same kind of question. The answer is inhibition of prostaglandin synthesis in the central nervous system affecting hypothalamic temperature regions. Okay, inhibition of prostaglandin synthesis in the central nervous system affecting hypothalamic temperature regions. Next question, the antipyretic action of salicylates. The antipyretic action of salicylates is explained in part by, the answer is a cutaneous vasodilation leading to increased heat loss. So the antipyretic action of salicylates is explained in part by the cutaneous vasodilation leading to increased heat loss. Next question. The locus of action of aspirin's central antipyretic effect is the hypothalamus. You just have to memorize this question. Remember that antipyresis means anti-fever. Pyresis is fire, okay? Antipyresis is anti-fever. So the hypothalamus is the locus of action of aspirin's central antipyretic effect. So the temperature regulation center is in the hypothalamus. So antipyresis is regulated in the hypothalamus when you take aspirin. So the effect of aspirin will be in the hypothalamus in the central antipyretic center. Okay. Next question. A patient who has been taking large quantities of aspirin might show increased postoperative bleeding because aspirin inhibits the synthesis of thromboxane A2 and prevents platelet aggregation. The first fact you must remember is that aspirin prevents platelet aggregation, and this limits your choices to A and B because option A says the synthesis of prothromboxane A2 inhibition of synthesis of prothromboxane A2 and prevention of platelet aggregation. And the second option is synthesis of prostacyclin that prevents platelet aggregation. So it's all about aggregation, 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 aggregation. That's the first thing you have to remember when taking aspirin. Aspirin does not inhibit the synthesis of prostaglandin. So, and we're just gonna review that again. Frequently asked questions on NSAIDs. The therapeutic effect of salicylates is explained on the basis of the ability of the drug to inhibit the synthesis of prostaglandins. Okay. Again, the therapeutic effect of salicylates is explained on the basis of the ability of the drug to inhibit the synthesis of prostaglandins. The mechanism of antipyretic action of salicylates probably results from the answer is inhibition of prostaglandin synthesis in the central nervous system affecting hypothalamic temperature regulation. Okay, again, the mechanism of the antipyretic action of salicylates probably results from the inhibition of prostaglandin synthesis in the central nervous system affecting hypothalamic temperature regulation. And how does salicylates, what is the mechanism of action, or how the salicylates achieve that antipyretic effect? And in part, this is explained by the cutaneous vasodilation leading to increased heat loss. Okay, the locus of action of aspirin's central antipyretic effect is the hypothalamus. You gotta memorize this. Remember that temperature regulation center is in the hypothalamus, and aspirin works in the hypothalamus, uh, giving a central antipyretic effect in the hypothalamus. So we're going to read a little bit about aspirin. Um, in Board Busters. Okay, so aspirin. Okay, it is important that you avoid using aspirin, NSAIDs, barbiturates, narcotics, and erythromycin if the patient is taking theophylline when you have a patient with asthma. Okay, asthma is a syndrome consistent of dyspnea, cough, and wheezing caused by bronchospasm, which results from a hyperirritability of the tracheobronchial tree. Two types of asthma exist: allergic asthma, which is the most common, and idiosyncratic asthma. So remember, avoid using aspirin and other NSAIDs, barbiturates, narcotics, and erythromycin. Um, Aspirin is one of the drugs that can potentiate bleeding after an extraction. So aspirin, anticoagulants, broad spectrum antibiotics, alcohol, and anti-cancer drugs, they all can potentially increase the bleeding time. Why? Because aspirin has an effect on the aggregation aggregation of platelets by um, affecting, inhibiting the synthesis of thromboxane A2 to prevent platelet aggregation. Okay, so aspirin also, uh, yeah, so what we were saying, aspirin and NSAIDs inhibit platelet aggregation. Thus, if patient, if given to a patient already taking an anticoagulant, the effects can be life-threatening. A patient on anticoagulant therapy like warfarin, heparin, aspirin, or an NSAID will most likely have a thrombin, prolonged prothrombin time (PT). So a patient on anticoagulant therapy like warfarin, heparin, aspirin, or an NSAID will most likely have a prolonged thrombin time and bleeding time. For elective extractions, these patients should stop taking the anticoagulant for 5 days prior to extraction. Always consult with the patient's physician before recommending these. Um, so something important about an aspirin overdose. An aspirin overdose can have an effect on the pH of the body. Okay, so aspirin overdose can have a cause of respiratory alkalosis. So let's go back and review pH. Okay, an abnormality in one or more of the pH control mechanisms can cause two types of major disturbances in the body's acid-base balance. Depending on the condition, okay, again, an abnormality in one or more of the pH control mechanisms can cause two types of major disturbances in the body's acid-base balance. Depending on the condition, cause acidosis or alkalosis can be respiratory or metabolic. Number one, we're going to see first the metabolic alkalosis, and then we'll see the metabolic acidosis. Okay. Um, the metabolic alkalosis is a condition where the blood is alkaline because it has too much base or too little acid, which means high level or bicarbonate, occasionally causing an increase in blood pH. The major effect on the body is over excitability of the nervous system, which may cause tetany. Let's see how to pronounce tetany. Tetany, I believe.
Tetany.
Tetany, okay. Tetany. So, anyway, we were saying that metabolic alkalosis is a condition where the blood is alkaline because it has too much base or too little acid, occasionally causing an increase in blood pH. The major effect on the body is over-excitability of the nervous system, which means that which may cause tetany. The major causes can be diuretics like thiazides, furosemides, ethacrenic acid, in diuretics ingestion of alkaline drugs, vomiting gastric acid contents. So this decreases the acid, so that causes an increase in the alkalosis, or overactive adrenal gland in a a patient with Cushing's syndrome, or the use of corticosteroids. Okay. Respiratory alkalosis, a condition in which the blood is alkaline because rapid or deep breathing results in a low blood CO2 level. Major causes: hyperventilation from anxiety, pain, liver cirrhosis, low levels of oxygen in the blood at high altitudes, and aspirin overdose. And this is much less common than respiratory acidosis. What is a treatment? Ammonium chloride, ingestion of ammonium chloride. Now, a metabolic acidosis, on the other hand, is a condition in which the blood has too much acid or too little base, often causing a decrease in blood pH. When blood pH falls below 7.3, the central nervous system becomes so depressed, the person first experiences disorientation, then is comatose. The normal blood bicarbonate carbonic acid ratio is 20 to 1. A 10 to 1 ratio indicates compensated acidosis. Severe acidosis always occurs during CPR. Metabolic acidosis is excessive blood acidity characterized by inappropriate levels of bicarbonate in the blood. Major causes can be chronic renal failure, diabetic ketoacidosis, lactic acidosis, poisons and diarrhea, respiratory acidosis, excessive blood acidity caused by buildup of CO2 in the blood due to poor lung function or slow breathing. Major causes: hypoventilation, emphysema, chronic bronchitis, severe pneumonia, pulmonary edema, and asthma. Treatment: ingestion of sodium bicarbonate. So, anyway, aspirin is involved here as a major cause in respiratory alkalosis. That is a condition in which blood is alkaline because of rapid or deep breathing results in a low blood CO2 level. I'm not very, I don't have it clear why an aspirin overdose will cause a respiratory alkalosis, but okay, we'll check that later. So, NSAIDs are again have an inflammatory effect due to the ability to inactivate the enzyme prostaglandin endoperoxide synthase, which is a cyclooxygenase. So they inhibit COX2. Enzyme inactivation inhibits the cyclooxygenase step of the arachidonic acid cascade, thus reducing local prostaglandin synthesis. NSAIDs have anti-inflammatory, analgesic, and antipyretic actions. Prostaglandins are derived from the unsaturated fatty acids in cell membranes. NSAIDs decrease the production of inflammatory mediators. NSAIDs, the ability of NSAIDs to decrease the production of inflammatory mediators possess anti-inflammatory, analgesic, and antipyretic effects. A ceiling effect exists for the analgesic properties. Most NSAIDs work best for mild to moderate pain, although efficacy varies between NSAIDs. It's safer than corticosteroids for long-term use, but some NSAIDs have strong adverse effects, thus contraindicated in specific patient populations. Traditionally, NSAIDs reversibly reduce platelet aggregation, which is normal platelet function, and normal platelet function returns when the drugs leave the system. So, aspirin, cortisol, and ibuprofen, and indomethacin have significant anti-inflammatory properties. So, aspirin inhibits both COX-1 and COX-2 enzymes to diminish the formation of protective prostaglandins. Thus, they effectively reduce pain and inflammation, but can induce GI ulcers and are a potential adverse, and this is a potential adverse effect. Since traditionally no NSAIDs like ibuprofen, naproxen, and aspirin inhibit COX-1 and 2 enzymes, they are non-selective COX inhibitors. So aspirin, ibuprofen, and naproxen are a non-selective COX inhibitor. Okay. Um, Patients that are intolerant to aspirin may not be able to tolerate ibuprofen. So next, about aspirin. Aspirin can increase bleeding times as well as other NSAIDs that are non-selective like ibuprofen, naproxen, ketoprofen, and flurbiprofen. Also antiplatelet drugs. So aspirin, remember, just has an effect on on platelet aggregation because it inhibits the synthesis of thromboxane A2. Okay. So aspirin is a prototypical non-selective COX inhibitor that inhibits both COX-1 and 2 cyclooxygenases to inhibit prostaglandin productions. Aspirin's analgesic effects are better if given to prevent prostaglandin production, prevents worsening of pain. However, it cannot reduce pain already caused by prostaglandin buildup. Aspirin inactivates the cyclooxygenase enzymes that make prostaglandins, thus inhibiting prostaglandin synthesis. As a result, aspirin is an analgesic, antipyretic, and anti-inflammatory. Aspirin is an irreversible platelet inhibitor and can reduce blood clotting, causing prolonged bleeding. Aspirin may interact with warfarin or coumadin to cause unnecessary bleeding. So the antipyretic action of salicylates or aspirin is explained in part by cutaneous vasodilation leading to increased heat loss. Aspirin is an anti-inflammatory, antipyretic, and analgesic used to relieve headaches, toothaches, minor aches and pains, and to reduce fever. The GI tract rapidly absorbs it. Low doses of aspirin taken regularly can have cardioprotective effect. These low doses reduce thromboxane production of platelets to reduce, these low doses reduce thromboxane production of platelets to result in the inhibition of platelet aggregation. In this way, aspirin has the ability to inhibit the formation of life-threatening thrombi. The patient is taking ibuprofen. Aspirin is the analgesic that, if given while the patient is taking ibuprofen, will diminish the analgesic effectiveness of ibuprofen. When aspirin and ibuprofen are given together, the analgesic efficacy of both is less than that of aspirin or ibuprofen alone. Aspirin displaces ibuprofen from plasma protein binding sites, thus hastening its disappearance from bloodstream. It is then quickly eliminated from the body by the kidneys through urine. Aspirin inhibits blood clotting by inhibiting platelet aggregation in an irreversible manner. Inhibiting platelet aggregation prevents the activation of the coagulation pathway, thus no fibrin is formed. Aspirin does not affect the coagulation pathway. It just decreases the fibrin. Discontinuation of aspirin for 5 to 7 days allows for normal clotting time to reappear due to synthesis of new platelets. So, It just affects the platelets. Contraindications for aspirin or other NSAIDs, bleeding disorders, because aspirin increases the bleeding time. Also, aspirin should not be used in asthmatics. Children with viral infections with or without fever due to a potential association with Reyes syndrome. So it should not be used in children. Pregnancy, especially the third trimester. Peptic ulcer, as aspirin may cause GI tract bleeding or ulcerations. Adverse effects, GI upset overdose causes hepatic nephrotoxicity. Death if overdosed by respiratory acidosis. Salicylism describes all of the symptoms caused by ingesting extremely large doses of aspirin. Tinnitus, tinnitus, I think is pronounced. Vertigo, nausea, sweating, vomiting, headache, and mental confusion. So, okay, so there's more points about aspirin. Conditions managed by anticoagulants like warfarin and clomidine, and antiplatelet agents like aspirin or Plavix. This is important to understand. There is two ways of to decrease. Uh, there's two kinds of medication used for bleeding to alter bleeding. Number one, anticoagulants, and second, antiplatelet agents. So, anticoagulants are warfarin, comedine, and antiplatelet agents are aspirin and clopidogrel, which is Plavix. So, coronary artery disease, by helping prevent threat of myocardial infarction of these patients, to angina pectoralis, by preventing thrombus from forming in the coronary arteries. Myocardial infarction, drugs that prevent drug clotting, prevent the threat of future infarcts, and stroke. They help prevent a thrombus from forming, thus preventing the threat of a cerebral embolism. Next, aspirin and NSAIDs inactivate cyclooxygenase, what we were just reading, but must be used cautiously in patients with peptic ulcer disease. Aspirin affects blood clotting, GI ulcers, they cause Reyes syndrome, they have anti-inflammatory effects, and they have analgesic effects. Acetaminophen, on the other hand, does not have blood clotting properties, does not cause GI ulcers, does not cause Reyes syndrome, and does not have anti-inflammatory effects. It does have analgesic symptoms. So, codeine and aspirin. And this is important. Codeine preparation is a less efficacious opioid analgesic with moderate abuse liability. Codeine is a narcotic analgesic and antitussive, which is a cough suppressant that is weaker than morphine, less addictive, and less constipating. Codeine is usually combined with other drugs like Tylenol and Emperin. Remember Tylenol 2, Tylenol 3, Tylenol 4. Codeine and aspirin is called Emperin. Emperin is an analgesic, anti-inflammatory, and must be avoided in asthmatics and patients who cannot take aspirin because codeine precipitates acute asthma attacks. Now, codeine and acetaminophen or Tylenol, Tylenol 3, is a poor anti-inflammatory agent, but better than Emperin in the patients with GA problems, pregnant, or patients who cannot take aspirin. Okay, so that's codeine. Codeine can be mixed with acetaminophen or Tylenol and makes Tylenol 3, and can be mixed also with aspirin. Just remember that. Codeine and aspirin is Emperin, and this must be avoided in patients in asthmatics and in patients who cannot take aspirin, as codeine precipitates acute asthma attacks. Aspirin also can be mixed with oxycodone, and it gives good anti-inflammatory properties. The strongest pain medication you can prescribe in a patient in ambulatory basis. Do not take on an empty stomach oxycodone and aspirin. Now, oxycodone and acetaminophen is Percocet. It's better if the patient cannot take aspirin or ibuprofen, but lacks strong anti-inflammatory effects.